When it comes to treating erectile dysfunction, as we described earlier, the first line therapies are the common viagra and cialis. About 78% of men do well on these oral pills. However, those men that don't, they move on to the second line. Second line therapies include things that are a little bit more invasive. One of them, which is the vacuum erection device. Next is intraurethral suppositories or gels, where these gels, they're composed of an erectogenic agent that are absorbed by the corporal bodies of the penis, allowing for those to get engorged and having a better, stronger erection. Finally, within this category is something called intracavernosal injections. Similar to the gels and the suppositories, this is an erectogenic agent being directly injected into your corporal bodies. And what that does is it really increases the concentration of that erectogenic agent within the penis, creating a much stronger and longer lasting erection. Finally, if the first and second line don't work, we move on to the third line, which is surgery. The surgery is something known as the inflatable penile prosthesis. And this is the gold standard when it comes to the penile prosthetic devices. It's a 3-piece prosthesis where there's a reservoir that generally sits in the lower abdomen, there's a pump that sits in the scrotum, and then you have the third piece, which is the cylinders that sit in the penis. Whenever you want to have an erection, you're able to pump up the device in the scrotum, allowing for fluid from the reservoir to go into the penis, creating an erection on demand, really. The benefits of the penile prosthetic surgery is that you're able to have an erection whenever you want, as I described. And also, the erection could last for as long as you like. Typically, after you have intercourse, you have a refractory period where your erection will go down. But with the prosthetic device, that doesn't happen. So as long as the device is pumped, you should be able to have an erection. The penile prosthetic surgery has no impact on your orgasm, your libido, or your ability to ejaculate at all.